Good afternoon, everybody. Dr.Navhya here again today, and as promised, I'm talking about a very commonly used diagnostic tool called X-rays. Now, for those of you who want to impress their children today, the first X-ray was taken in 1895 on 22nd December. It's my mother's birthday, not 1895, 22nd December, and thus I'll remember it. And this is how I remember things: association, you know. And it was a German, called Willem Röntgen, who was the first person who did this. And thank you to him, medical science changed overnight after that. And guess what? The first X-ray that he took was of his wife's left hand. Oh, mushy, mushy. So even in science, husband and wife can work together. Those of you who you hate couples and hate marriages, there's something for you. Maybe she was an inspiration for him. So yes, so William Röntgen, a German man, 1895, more than 100 years ago, on 22nd December, gifted the world the power of X-rays. Now, what is an X-ray? Very simply put, it's a very highly energetic electromagnetic radiation. So these charged ions are passed through and they come and hit a solid object to produce an image. Our bones being very solid, very dense, and they have a lot of calcium. So when these charged ions come and hit it, it produces that white picture on an X-ray, and that is why, suppose this was your bone, and there's a fracture that happened here. This entire thing is going to show as a continuous white band, but wherever there's a fracture, there's going to be no white band. So you understand that the ions have not gotten absorbed there because there was no calcium there, because there was no bone there, because there was a fracture there. Just to simply make you understand that. Now you must be thinking, well, I know all this about X-rays. Like a doctor writes it, I go, I get it done, then I wait for the report. um, what I want to tell you today is that X-rays fall on the list of carcinogens. uh, don't be alarmed. I'll tell you more about it and how it can still be used and how it's not that alarmingly unsafe. But yes, WHO, the World Health Organization, has got a list of elements which can possibly cause cancers in human beings by gene or genetic mutation, and X-rays are on that list. Now you need to know that. You need to be an informed patient to understand this. Now I don't want you to go running away and be like, oh my god, I got an X-ray done and I'm now exposed to cancer, or I'm at a high risk for cancer. X-rays are on the list of carcinogens, but it will take you about 10,000 X-rays to get that much of radiation. But sadly, it will take you about 25 CT scans. Now that is the catch. Um, so you must be thinking, like, now I have fallen down, the doctor needs to see my fracture, like what can I do? So yes, X-rays are a very important diagnostic tool, and surprisingly, for those of you who may not know this, we are exposed to background natural radiation all the time on a daily basis. Earth is being bombarded by cosmic radiation. There's radiation from the water, the rocks, the air, the vegetation, and this is natural radiation. It's harmful, but yet unavoidable. We can't really completely, totally avoid it. And there are a few studies which have shown that aviators and pilots and cabin crew and astronauts work, continuously working at the high altitudes. This may be possible occupational hazard for them, radiation exposure. There are few studies, there are small studies, but there are studies who say this. So now we can't possibly do anything about the natural radiation. We are exposed to it one way or the other. Some parts of the earth are more exposed to it, some are a little less, some occupations a little bit more, some occupations a little bit less, but we are exposed to it. Um, X-rays are an avoidable radiation exposure. So I have made a small, okay, let me first tell you the common type of X-rays. So there's a plain X-ray, uh, say maybe an X-ray of a hand, an X-ray or of a lung, and a chest X-ray, that is. And in this kind of X-ray, the smallest dose of radiation is what you're exposed to. The second set is called fluoroscopy. Now, here they need to see a contrast. So, suppose they want to see your entire food passage, which is a GI tract. They introduce something called the barium meal in your body. Now, they will take frequent x rays to see the journey of this barium meal, through your system. And obviously, this takes a longer time, and there's a contrast which is used. And so, in fluoroscopy, you're exposed to a little bit more dose of radiation. And then comes the CT scans. Now, most of you who don't know, CT scans are nothing but computerized X-rays. So they are, computed topographs. And in this, what happens? Uh, a beam of X-rays is sent to you. Your body is moving through this X-ray machine in a very slow motion, and these beams are hitting you at different places, different angles, to basically capture different slices in a series, to then make an entire 3D image for the doctor to see. Of course, it tells us much more because it's a 3D view, but the time that it takes and the level of radiation that we are exposed to is the highest in a CT scan. So those are the drawbacks. And in CT scans where a contrast has to be used, sometimes people can develop just normal allergic reactions to it. Sometimes they can have very severe anaphylactic reactions to it. And most of the times, people whose kidneys are already compromised, who are diabetics, end stage renal diseases, renal failures, they cannot, I mean, it's a very dangerous procedure for them because that contrast is toxic to the kidneys sometimes. So, plain x-rays, less dose of radiation, then comes fluoroscopes, a little bit more dose of radiation, and then comes CT scans, maximum dose of radiation. So you have to remember, CT scans are nothing but computerized x-rays. Now that's important. Now, one sec, I just ate lunch, I think. So should you, are you supposed to be running away from all x-rays? No. I've made two lists for you, which is very important. One is to explain to you, just in numbers, as to how much some basic x-rays are exposing you. So when you get an x-ray chest done, it's exposing you to almost equivalent of 2.4 days of the natural background radiation. I do make notes. I study before I speak. A skull x-ray, almost about 12 days of natural background radiation. The radiation that we talked about. 12 days, one x-ray. Lumbar spine x-ray, 182 days approximately. IV urogram, 1 year approximately of NBGR. Upper GI, 2 years. Barium enema, 2.7 years. CT head, 243 days. CT abdomen, 2.7 years again. And these numbers, so when I say CT abdomen 2.7 years, it means when you get a single CT abdomen done, you get as much radiation as you would have gotten 2.7 years, almost 3 years of exposure to the natural radiation. So for somebody who's gotten, say, 2 CT scans in a month, he's already got 5 years worth of radiation, plus 5 years worth of radiation that he's exposed to and by the natural elements. So it's a 10 years worth of radiation. Now that is why a rough number in a lot of studies say that you will need to get about 10,000 X-rays done to be exposed to a very dangerous amount of radiation, or about 25 CTs done to be exposed to a dangerous amount of radiation. In my view, if you can avoid them, they should be avoided. And the same request goes to all the medical fraternity that if you don't need them, please don't write them. And I'm going to give you a small help kit as to how can you limit this exposure. Now this is what is important for you to understand. Neither to live in fear of x-rays nor run away from them, nor spread this information saying, oh, they just cause cancers. You need to understand the whole context. This is what you need to focus on, and this is what you need to probably share with other people and your family members. So one, you must ask your doctor as to why and how will this x-ray that they're asking you for help you in treatment. Two, ask if there's an alternate available for them to figure out the same details. Three, don't just blindly refuse an x-ray because it's an important diagnostic tool. It gives much more information at a much early stage to a doctor to help you feel better faster. Three, don't even insist on one. Now, some people, for anything and everything, X-ray, CTs are like a shopping for them. It's like eating chaat papdi down the street. It's like एक X-ray करा लेते हैं. अरे X-ray छोड़ो, CT scan कराओ. So, don't be an over enthusiastic individual when it comes to X-rays and CTs. Neither refuse them blindly nor go shopping for X-rays and CT scans for anything and everything if not needed. Definitely inform your doctor if you're planning to conceive or if you're pregnant. And be very careful with children. Avoid it as much as possible. Yeah. Now, the most important thing according to me is keep your X-ray history, keep your CT scan history. Don't just so somebody thought you have a wrist fracture, you got one test done, it came normal, you threw it away. Don't do that. Maybe in 2 months you fall again and you need another X-ray of the hand. You can use this X-ray or something to show to your doctor. So it's very important to keep your X-ray history and your CT history just like your medical history. And if you don't keep your medical history, please start recording your medical history. And so that this old X-ray can be used sometimes by the doctor and a new one can be avoided, especially in chronic diseases. Yeah. Now, most important, as hospitals, please provide lead aprons and protective shields, not just to your X-ray technicians, but to patients. And as a patient, please ask for it. It's kind of like a duty you have to yourself because this limits the exposure of radiation to your body. A lead apron or any other protective shield that the hospital might have. Now, I need to speak a little bit extra about dental X-rays. This is important because a lot has been said about dental X-rays, and you need to understand the whole concept of it. Now, most importantly, you need to understand the measure. So, microsieverts (MSV) is how we measure radiation, X-ray radiation that we are exposed to. One intra ocular intraoral X-ray can expose you to about 8 to 9 MSVs of radiation, which is not too much. Now, what you need to ask your doctor is this: if they are using conventional D film capturing methods, D as in delta, the exposure is going to be twice. It's going to be about 18 or 19 MSV. Whereas if they're using the modern ones as E or F speed, echo and foxtrot, that is speed, capturing mechanisms, the modern ones, then it's just going to be about 8 to 9. So it's almost half by using a better technology. And there may be much, much better technologies now, which you can ask them about, which have even reduced the dosage. A full mouth X-ray exposes you to about 24 MSVs of radiation, which is quite a lot. Quite a lot for one X-ray, quite okay for the overall radiation that we are exposed to naturally. So you have to see it in context. Now, you definitely keep your dental X-ray record history. There are very specific guidelines given, to the Radiological Association, and my request to doctors is to keep training their technicians and themselves to understand that and follow it very strictly. There is something called ALARA, ALARA. This means as low as reasonably achievable. This is one of the guidelines: as low as reasonably achievable. So keep the numbers as low as reasonably achievable. Keep the dose of radiation as low as um, achievable. And this is one of the broad guidelines given. So nothing to be scared of X-rays, but something to be aware about. My little talks are not to scare you or make you paranoid, but they are to get to show you your body in a different light, health in a different light, that sometimes a little precaution can go a long way. And let's take a moment to thank all the X-ray technicians. So now this is the spiritual me. This is the Noma in me speaking, who's telling you to do this act of kindness the next time you happen to be in a hospital or you happen to get an X-ray done. Say thank you to a technician, because a technician is exposed to these harmful radiations for a very long time. So number one, we have very few qualified senior X-ray technicians in India. Number two, their working hours are much long and they're stretched, and sadly, I have to accept this. They always end up working more than the prescribed limited hours that they're supposed to. Three, lots of hospitals flout rules and don't give them radiation batches, where constantly that batch measures as to how much radiation is being absorbed by them, and if it starts to reach a certain dangerous level, they're supposed to actually be sent home on leave and off duty, so that that radiation can be, those levels don't cross a dangerous mark, which sadly, okay, some hospitals may be doing it, some may not be doing it. Let me put it that way. Four, as X-ray technicians, please know your rights. You're a valuable part of our system, and your health is as important as the doctor's health. So please, please support these people. And as patients, understand that they are also risking their own lives to bring you a better medical facility. So be kind to them the next time you go. Say a kind word to them. Listen to them when they give you instructions. Those little things matter. Matter. Let that be your act of kindness for the day, as Om Swamiji always talks about, and he calls it RAK, random act of kindness. This can be one of your random acts of kindness. And now that you understand the danger that an X ray technician is putting himself through, being exposed to that radiation all the time for long hours, maybe for 20, 30, 40 years of his life, as long as he's working, that's his bread and butter. So, a scientific element, a spiritual element, and that's what makes life beautiful and worth living. I hope this information was helpful. I know I give you very basic, very general information, but believe me, health is all about the basics. I want to make medicine easy. I want to make health reachable. I want spiritual health. I want joy to all be a part of your everyday life. Thank you so much for your time. This is Dr. Navhya signing off, and I hope you know something more about X rays today. Bye bye. Good afternoon.